just remember, you have all the information that you need. You've gathered it through the course of taking med-surg, your P's, your all of your courses prior to this one. So there's not any new information. So you just have to recall it. So let's go over ADAPI. So you all tell me, what is ADAPI? I'm going to share my screen here to help you out.
Yeah, please do.
Okay. And it's a test-taking strategy also. Well, it's meant to, provide so that you can provide the best care for your patient. But it helps you select. Let's see, how can I make this large? Are you all able to see this over here?
Yes.
Okay, yeah, I made it large. Okay. So assessment. You're gathering information. So as you read through the question, that's your patient, that's your scenario, whether or not it's at the community center, whether or not it's at the school, you're the school nurse, but you're gathering all your information. And with that, you have to ask questions. You're gathering subjective information, things that the patient or the participant or the resident, whatever you call them, the patient, the student, those things that the student is saying, all that subjective information. And the things that you observe, for example, if you observe while they're talking, they're fidgeting, this is objective information. You can have chart obtain objective information also. So for example, you're looking through the chart and you're looking through the student's record and you see that they have a history of diabetes, asthma. So that is also objective data, but it's just obtained from a record or a chart. So you want to gather information as you read through the question. What is this question about? Identify what is that concept. And then there's usually like a second part of that question. What is it about that concept that they want you to answer? Do they want you to answer something that's positive or negative, true or false? Whichever words that help you best understand how to answer. That's why I say true or false or negative or positive. Some people like to use the word, well, I need to select something that's negative or false. So whichever terminology you like, but it's tomato, it is the same thing. So you're assessing. So recall your information as you're reading through that chart, or that person is reporting to you that they have asthma, they use the inhaler. Recall, what body system does this involve? The respiratory system. What are the functions of the respiratory system? What does the respiratory system supposed to do? Gas exchange. Well, if they have this disease process, something's going wrong with the gas exchange. The intake of oxygen, the expelling of carbon dioxide. So if you have to go back to that level so that you can ensure that you are understanding how to best take care of your patient. So the questions are there, but it's really a patient. It's a community, which is still your patient that you're trying to take care of. So just keep that in mind. Don't think of it as just like, well, it's just a question I'm reading to take this exam, but it's really a patient. So recall on your information, which body system, which organs, what is the purpose or the function of those organs? Well, if this involves the lungs, well, that means the lungs is not doing something they're supposed to, even if it's down on the bronchial tree level, that gas exchange is not taking place. So then that helps you form, it constructs your thought process. So when you move forward, you can identify what is the problem. That also helps you identify to prioritize what the problem is. So if a person has asthma, they have fallen and they've fallen, they scraped their leg. But once they call you over to the gym, you see that the student is having trouble breathing, but you see that the leg is kind of bleeding too because they scraped their leg. So which one would you pay attention to first? I mean, you just throw a little bandage or something on that leg, but you want to get their breathing under control. So by you recalling, doing your assessment, whether subjective or objective, you're coming in, you see the student, the chest is just moving fast. It's rising and falling really, really fast. They can hardly complete sentences. Even though that you don't know that they have asthma, you do realize that they're having a problem with gas exchange, which is the respiratory system, which if that heart and those lungs are not doing what they're supposed to, cardiac arrest is, cardiorespiratory arrest is pretty much imminent. So you want to prioritize, hey, we need to call 911 really quick. If you have oxygen on campus, which most people don't, we need to get, this some oxygen. We need to check the O2 set. So it begins to help you prioritize what the problem really is. So when you're looking at your answer choices, more than likely, all of them are going to be correct when you're having to select all that apply. But they want you to prioritize, select the one thing that should be taken care of first. And then that helps you formulate or put in order or prioritize what should you be doing first. I need to go get some normal saline to clean the leg up. I need to get a bandage. I need to measure the wound. No, this slap something on. This baby is having trouble with gas exchange. We need to be taking care of that. And then, which leads us right into planning, developing those goals and desired outcomes. This is you looking through your answer choices and selecting which one that should be acted upon. So what I'm saying is, when you're taking these exams, HESI, the NCLEX, the unit exams, ADAPI still applies. So don't make it be something new. You're still going through this nursing process. Planning, again, like I said, is that you selecting the correct answer, which one should be selected, what action should we take. Implementation is also selecting the correct answer, because that is us doing it, whether or not it is educating that patient, performing a nursing action, performing CPR, performing that dressing change, or I think we had an example where the patient went home and they were on precautions prior to going home. They were in the hospital, they were on precautions. What information should you provide the family members or that patient once they get home with the soil dressing changes? Well, you still want to educate them about placing those soil dressings in a separate bag, make sure it's tied up, and also doing the hand hygiene. So the implementation is the doing. It's also selecting the correct answer, whether or not it's educating or actually performing or doing something. And then you want to come back and evaluate, well, did this do any good? Did the students' breathing get any better? After we talked to them, it was just that the person had got worked up and they were just anxious. So now the breathing I'm counting the respiration. They're back between 12 to 20, or the O2 sat is back up to 98%. So you're evaluating to see if you're back toward the norm, which, remember, we went back to what the respiratory system is supposed to be. What are the normal respirations supposed to be for a child or an adult? What is that O2 sat supposed to be anyways? So again, I said all of that to say, you have the information. You just need to read through the question. It is your patient. And go through the ADAPI nursing, which is the nursing process. And even if you have to, I think doing HESI, can you all have a board? I think you all can have a board. If you need to write this down, or write down true or false or negative or positive, those things that you need to write down on your scratch paper, so that so it keeps you focused. Any questions about the nursing process or how to read through those questions, identify what is the main concept, and then selecting the correct answer. Any questions or feedback or tips that you all would like to share?
No, I don't have any questions.
Okay, all that made sense. If it didn't make sense, now I can go back through it and give you a different example.
It makes sense.
Okay, I promise you all have the information. You've gathered it through going through all of your courses. You just have to sift through it and go through. In the nursing process helps you sift through it. Because I said you have all the information. So if you have to go back to identifying what the respiratory system is for, and then move forward like that. Okay, and so the next thing that we'll go over is some of the topics. And so that was the purpose of that HESI prep assignment. Each of the disease processes, it was just going through, finding out all that information, the nursing considerations, the patient teaching, and that was just helping you to stay focused on those topics that you would encounter while you're taking this HESI. So the first one I think was anthrax. So your patient has anthrax. What do you recall about anthrax? Run. No, for real. What do you recall about anthrax? This is a scary one. What do we remember? Was it in the news a couple years ago?
It was in the news, and wasn't it like a powdery substance? You didn't know, you couldn't really tell what it was, and it would kill people.
Exactly. So what body system did it, what body systems did it mostly affect? Because the person had to come in with it first.
I think it was respiratory.
Uh-huh. And so they had to come in contact with it, particularly the skin and then the respiratory system. So if they breathe it affected the respiratory system, what are those things that you need to be looking for in your patient? If they bring the person in, you're in the ER that day, and they're saying possible anthrax exposure, you automatically would start looking at what body system, and counting what, and measuring what.
You would check vitals, check the respiration, pulse, oxygen level.
Exactly. And you should expect to start what on that person? The doctor should probably order what? Because we know it affects the respiratory system. You're going to check the respirations. You're checking the O2 set. You're checking the heart rate. So we expect those things. We expect the respiratory system to be regular and unlabored, or labored and fast. Well, this means the same thing. What do we expect it to be if they've been exposed to anthrax? Respirations are going to be fine, or they're not going to be fine?
No, the respirations are not going to be fine, and it will be labored.
And so what should we expect that doctor to order? We should start
antibiotics.
Not antibiotics right off.
Oh, a chest x-ray, sorry.
What else before that? Chest x-ray, and what else?
Oxygen.
So what should we expect? What should we do as that nurse? Something that we can do to help with the respiration. That person's laying flat.
Have them sit up. Have them sit up.
Raise the head of the bed.
Raise the head of the bed. Exactly. So that's an example of, let's go back to Adipine. So we gathered our information. They told us, they said, we didn't even have to ask questions. We think they've been exposed to anthrax. So that's gathering the information. And so we're diagnosing and planning. So we're looking at the person. They have a increased respiratory rate. The O2 sat is down. So even though the person is really not talking to us, our priority is, let's get something to help this person oxygen, the gas exchange. So our action plan would be, lift the head of the bed up. Let's raise to high fowlers. We should expect that doctor to say, order some oxygen, chest x-ray. And then the implementation part of it is you actually get it down, raise the head of the bed up, checking the O2 sat continuously, putting them on a monitor, and then evaluating. Is respirations getting any better? Yes or no? And if not, okay, what's next? So we just went through the nursing process or Adipine with anthrax. You recall what anthrax was. It was like It's serious exposure to a bacteria, which specifically it attacks the respiratory system. That bacteria affects the gas exchange. And then once we get that person stable, then we should look to be able to start that person on someone said it, antibiotics. But to prioritize, we want to see what the respiratory rate is. So we're counting, we're checking the O2 set, we're getting the head of that bed up. So that's what we just did. So essentially, that's what the purpose of the HESI prep assignment was, for you to recall what that disease process was, or that bacteria, and then move through the Adipine process with it. All right. Any questions about what was that, anthrax? Any questions about anthrax?
No.
Okay. So let's do smallpox. So which body system is mostly affected?
The skin.
The skin. Okay. And so what should we expect to see? They wheel the person in, possible smallpox exposure. What should we expect to see?
Skin rash.
And so we should immediately be putting them on what type of precautions? Because we know that smallpox is spread through what? It is contagious.
It's spread through contact.
Contact, exactly. And so we might want.
Yeah, contact precautions, so you will wear gloves, gown.
Mm-hmm. Yep. And so when we do our assessment, let's go back to Edify. They told us, hey, this person we're gathering our information, our subjective, objective. We see the rash. They've told us what the diagnosis most likely is. So let's start planning. This person, let's recall what smallpox does. So we would check what? We're looking at the skin. We've done that part. What else should we be checking to see if they have what?
Vision changes with their vision.
What else?
Come on, somebody help me out.
What about fever, headache? They're having joint pain. So we want to ask if they're having all of those things because we know that is specific with smallpox. We'll see the rashes and we know it's contagious. So we want to do those contact precautions. We want to suit up, immediately post our sign. And then we want to see if they have a fever. Have they asked them, hey, have you had a fever over the last couple of days? Or is this just sudden onset? You know, does your head hurt? You know, do you have any back pain? And so, and then we can go ahead, expect to administer anti-analgesic, some Tylenol or some Motrin or something like that, some pain medication, and, you know, antibiotics moving forward. So what else about smallpox? What else do you all remember? Let's go back to Edipal. Let's make sure we got everything. We assessed it. We gathered our information. We asked questions. We got our S and O. We identified our problem. Developed goals, our action plan, implement it, and we evaluate. And we'll go back and see, has the fever come down? Is the antibiotics, are they working? You know, are the lesions, are they macules? And because, you know, they progress from macules to pustules. So we need to see where along the way, like pretty much what day are they probably in reference to smallpox. Like are they in day 10 or is it early on? Because early on you'll see macules, but later on there's a difference in the way that the skin will look. You'll see those pustule vesicles later on. Any questions or concerns about smallpox?
No.
Okay. All right, so botulism. So they wheel the person in. I think they have botulism. So what would that person look like? We're gathering our objective data. Botulism. What are some things we may see? We're assessing. What about breathing? Is it going to probably be normal, abnormal?
I think it would be abnormal.
Yes, because usually it's not you know, treated. Respiratory failure is imminent. What about the extremities? Someone that's been exposed to botulism, what about their extremities? Are they going to be able to move their arms and legs? Are they going to have good range of motion, or is it going to be paralysis or weakening of the extremities?
I think weakening of the extremities. Is this the one that attacks the nerves?
Exactly. So yes, when you see the word botulism in your test question, okay, let me go back. What is it that I know about it? It attacks the nerves. So we should expect to see some limitation or some weakness or some paralysis with those extremities. And so what else? What else about botulism? And, you know, they do, and this is getting way off course, but they do use a derivative of that for treating people, but we're talking about just exposure to botulism outright, which is life-threatening. What else about botulism do you all remember?
That's
So,
pretty much all I can remember.
Okay, so if it attacks the nervous system to paralyze it, what should we kind of expect the person to, what kind of treatment, or should, I'm trying to not tell you the answer. We should expect this person, more than likely, this person probably is going to end up on a what? Because we said it attacks the nervous system, so it paralyzes all those muscles. So we're going
They
to
end up on a vent?
exactly, more than likely, a ventilator, mechanical ventilation is going to be part of their treatment because it doesn't. It's going to slow down that respiratory system. Respiratory failure is pretty much imminent, and it's going to attack it. So in order to prevent respiratory failure, a treatment would be to expect this person to be in ICU. They're going to be using a mechanical ventilation. And then just monitoring the respiratory system is going to be of utmost importance. All right. Let's see. So let me just skip around on our little list here because I know our little time is going to run out. But are you all seeing how you recall what you know about that disease process and going through that nursing process and you identifying what you need to be assessing, how you plan and looking forward for those nursing considerations, your client teaching? Is that becoming a little clearer to you, or is that still not making much?
It's coming together for me.
Okay, it's coming together. Okay. All right. So let's what about months? So we're doing our assessment. What are those things that we're gonna see?
Those are like the bumps underneath the skin.
Where particularly? We're gonna see swelling or enlargement.
Maybe on the side of your neck.
So your face, your jaw area. So in that area, it's gonna be swollen. Okay. So how is it transferred? What kind of precautions should we expect to be using with a person with we think they have mumps? Because how go back to how is it spread?
Mumps is a viral infection.
Mm-hmm. So how we think it's spread? Person coming in contact with what? The saliva, the droplets in one way or the other, whether it's through air or just direct contact with it.
Okay, body fluids, okay.
Mm-hmm, body fluid. And like I said, it is contagious, so we do want to prevent. So we put on those, those extra precautions. We may have to post we'll have to post our signs in the room or outside the door, provide the education for the family. As far as the patient, we would want to encourage what? Because they're probably not going to be feeling good. It's located the neck, the mouth area. So we'll probably have to do some mouth hygiene. Going to probably encourage fluids, particularly pick fluids that are not going to be aggravating to the oral mucosa, like cool fluids, or kind of warm but not hot things that are not spicy. We want to treat if they have a fever. We want to administer those, the Tylenol, the Motrin, encourage the fluids, and just let it run its course. Okay. So if we have a person that's exposed, or we think that they have tuberculosis, what is a secondary intervention that we do if you work at a healthcare facility, if you work at a daycare, which is also considered a roundabout healthcare facility? What is that secondary intervention that they pretty much do every year for their staff to determine if they
You get a PPD shot.
Exactly. Okay. And so if a person has a positive PPD, no, let's back up. What's some signs and symptoms of, so we're doing a primary intervention. We're just doing a TED talk about tuberculosis. So what are some things that we're going to tell or include in our little TED talk about tuberculosis? What are some signs and symptoms? What is it? which organs does it affect? Which body system? So tell me, what would you be saying about tuberculosis?
It affects the respiratory system.
Mm-hmm. How is it spread?
I believe it's airborne because that person will be on, would it be droplet precautions? That's why you have to have the N95 mask.
Okay. And so what are some symptoms? Person comes to you and what are some symptoms you're going to tell them to look out for or to report or seek medical care if they have been complaining about what?
Coughing, chest pain.
What happens at night?
You have night sweats.
Mm-hmm. Weight loss, unintended weight loss, loss of appetite. What about that sputum? What's specific about that sputum?
Is it yellow?
Not yellow.
You have blood in it.
Exactly. Have blood in there. So tertiary. We're talking to people, a group of people that they don't have active tuberculosis. Well, they may have had it. They have active tuberculosis. So what is some client education about medication that we will tell the patient? What about those medications? We know that's an issue because they have to do what with those meds? What is usually a problem with the person that has tuberculosis and medications? Do they take them for a long time or they just take them? Is it just a 10-day course?
It's a long period.
So we would expect to be doing that for tertiary to teach them, hey, up front, you have to
Make sure to take all your medicine and come and make sure you're not stopping the treatment early because you feel better, things like that.
Exactly. You expect to take this medication for months. Sometimes it's 6 to 9 months. Expect to take this for a long time. We need you to take all the medications as prescribed so that it doesn't double back on you and you go back to being active again. You know, you want to protect your family. So that's that client education. And then once the patient come back in the clinic, you go look in the little directory and you see that they have been getting those medications filled. Those refills have been getting refilled as needed, not as needed, but as pretty much on time. That doesn't guarantee that they're actually taking it, but usually if a person takes the time to go and get the medications filled, more than likely they're taking them as prescribed. Okay. Any other questions about tuberculosis? Any other questions? So what's that most effective part of infection control that we can do to reduce infections?
Wash your hands.
At home, while we're out and about, in the healthcare facilities, yes. And we kind of spoke to this already about the tuberculosis, brought up that N95 mask. That person's on airborne precautions. So we should expect to have that on to take care of them. We talked about contact precautions. So contact precautions, if we come in contact with whatever that is, the potential to get infected is very, very high. So we want to do things to prevent contact. So I gave you the example with the person going home, they had the wound and they're having to get the dressing changes. So what is that client teaching for that patient, family and that patient once they get home with those dressing changes? What do we need to do with those soil dressings? Just throw them in the garbage can?
Put them in a bag.
Because remember, contact precautions, we don't want to come in contact. So we do things to limit contact. Just like for airborne, we do things to limit our airborne, our inspiration, our inhaling of whatever's in the air. So that's why we would put on that particular mask to prevent that airborne contact. Does that make it a little bit clear about the different precautions, contact? It is what it is. I don't want to come in contact with whatever it is. It's airborne, so I don't want whatever's in the air to get inside of me. So what do I do to prevent it? Because I'm breathing, so I need to put something on to protect my nose and my mouth. So we do know that those TB, like we said, the secondary intervention, which is giving that PPD test, and also for those that have responded positive to it, but they got the chest X-ray and it just shows they had been exposed, but did not have active tuberculosis, and they get those chest X-rays thereafter. So we say that by doing this secondary prevention, the vaccine, that it has reduced, has it helped in tuberculosis, diseases, incidences of tuberculosis in the United States? Will we say that this has helped by healthcare facilities doing this? Yes. The treatment has helped greatly to reduce the incidence of tuberculosis in the United States. All these things that really have helped. So if you are looking for information, for example, you're working at a health department, and you're trying, we talked about reportable diseases, and you're trying to determine whether or not the disease that the person came in with, or your case, one of your persons on your caseload, like, well, what do? I report this disease, or is this a reportable or not? So you always want to go to that website for wherever you're working at. They will also have a policy procedure book. But if you can't find it in their policy, everybody's putting everything online now. So each healthcare facility, for the most part, has a website that you can go to and find like their policies, their reportable disease list. And then if they don't have it on there, well, it will refer you to maybe like a CDC's website. But initially you want to go to where you're at, whether it's at the nursing home, whether it's at the health department. You want to go to their website or their directory, their policies and procedures, before looking on the CDC's website, before going to WHO's website, the World Health Organization's website. You want to go there first. So what do we know about genital herpes? Is it a bacteria or is it a virus?
Virus.
Virus.
Okay. And so would we expect the person to be a prescription for antibiotics or antivirals?
Antivirals.
So again, go back to what you know about the disease process is a virus. So are those persons, excuse me, only contagious when they have open sores?
No, they're contagious all the time.
Way before that the sore gets, or the bump or the area gets to be open, they're contagious before then. Is it only in the genital area where you would see those raised areas?
No, can it be around the mouth too?
Exactly, because it's type 1 and type 2. So yes, so it is not just only in the genital area. Okay. So what do we know about the human papilloma virus? And then the vaccine itself.
With the vaccine, it helps prevent you from getting cervical cancer.
All of them or some of them? Because they're different kinds.
Some of them.
Okay, so remember when you're reading through your test questions, those 3 letters, all or but, it kind of most of the time it excludes that being an answer choice, because rarely are things all. So just be careful with those words that are in your answer choices or in your question. If you're reading your scenario and it is telling you, which ones are more likely or least likely. All right, let's go here. Let's look at some case management. So what is case management? Does it help us provide individual client care or the whole med-surg unit case management? Because you can be that nurse is working in case management. What kind of care does it help you provide? Group care or individualized care?
Individualized.
Individualized, yes. Okay. And some client education, if our patient has been referred out to specialties and specialists, we want to provide what type of education to our patient, because there's a chance for overuse, underuse, or the gaps in care. So what conversation, tell me what would that conversation be like for your patient if they have all these specialists to go to? If we know that overuse, underuse, or gaps in care may result as a result of having all these specialists, our patient might not want to go see all those people. Well, Mr. Dr. Sam has been taking care of me. He's been doing fine. I don't want to go see all those people. So that will result in underuse. And then, which also can lead into gaps of care. But then sometimes Dr. Sam has referred the patient to Dr. Teal, and Dr. Teal has says, okay, we've done everything that we need to do, but now I'm gonna refer you back to Dr. Sam. And then the patient, no. Well, since Dr. Teal said everything is well, stable, then they don't follow back up with the primary healthcare provider. So we want to have that conversation. Okay, it is necessary that you keep your appointments with your primary healthcare provider and also the specialist, because we don't want to result in overuse, underuse, or have gaps in care. We don't want to miss anything. I know you're better now, but we want to keep you, being stable. So it is very important that you go to all of your appointments, even though if you have to reschedule some, even if we have to identify resources to get you there, because a lot of times in the rural areas, these specialists, they only come to town one day a week, if they come then. I know, like in my own experience, we have a urologist. He specializes in prostate cancer, but he only comes once a week to the town. But now because he is taking on a new procedure or trying to put this new procedure out there, he doesn't even come once a week to the neighboring town, which is an hour and 45 minutes away. So what do you think those patients are going to do? It's going to be underuse, gaps in care. Well, he's never there. So you have to have those conversations to encourage them. Well, hey, we can identify some resources to get you maybe monetary, or sometimes there's public transportation that takes people to these appointments, because we don't want overuse, underuse, or gaps in care to occur. Case management, it is time demanding because it is individualized. And most of the time they call in the case managers to deal with those complex cases. A person that has multiple disease processes. And so, but case management is there to provide the individualized care, but more than likely, those are going to be the top ones on their list. The people that have multiple disease processes, they need multiple resources to be identified. They need multiple resources to be set up. And so those would take precedence over the others. But case management plan should be individualized for each client. Because even though you have 4 people that have diabetes, the 4 patients one of them might also have asthma. The other one might also have a prosthetic leg. The other one might be a veteran and might have PTSD. So you can't clump them all together because all of these just have one disease process in common. You still want to provide that individualized care. So a person who has a high cost of chronic diseases, so a person that has multiple chronic diseases, they really, really want to make sure that they have case management. All right, let's see here. Any other questions or anything you all just wanting to go over out of our topics? Teen pregnancy, teen birth rates in the United States, they have declined over the last decade, but it's still, an issue that needs to be addressed. So, have the conversation. It depends on what setting you're in. You're guided by those rules and regulations as what you can say and what resources you can identify. If you're that school nurse, find out what your rules and regulations are as far as, can you bring someone in to do a demonstration or talk about whatever? You might have to refer that person back to their parent or guardian. If the person, we want long-term goals, so we want to ensure that team finishes their education, that they graduate. We might have to alter like the seat time, but we don't alter them getting the courses that they have to actually take. For example, the child might have to be hybrid. They may take classes at home on Mondays and Wednesdays because they don't have childcare on those days. So they Zoom in to class rather than actually coming to campus that day. But the long-term goal is that team finishing their education. Let's talk about bioterrorism and disasters. So we kind of talked about this last week about the disruption of water and because whatever has happened, we want to make sure that we boil that water for those 3 to 5 minutes. It is okay to add that 1 cc, which is like 16 drops of bleach to a gallon of water and let it stand for those 30 minutes. And if you think about it, the hot water heaters, that water's just sitting there. It's good water, just waiting on a faucet to be turned on, a spigot to be turned on. So you can drain the water from those hot water heaters. So again, let ADAPI guide you. If you have to, with your board or your paper or whatever is allowed during HESI or your unit exams, if you have to jot down some things to guide you along the way, if you have to write down what ADAPI is real quick. If you have to write down true or false, whatever it is that helps you select that correct answer, to help you think through the concept. If it's going back to the body system, the organs, what is that body system supposed to do? Are there any questions?